Since the Ebola virus broke out in March, there's been over 1,900 cases and over 1,000 deaths in West Africa. The Centers for Disease Control saying it's the biggest and most complex outbreak, with cases in Guinea, Liberia, Sierra Leone, and Nigeria. But what do we need to know about it here? Stamford Hospital's Dr. Michael Parry says residents shouldn't worry.
Because it's not airborne, it's contact. You'd have to be in contact with a person or body fluids of that person.
But that doesn't mean the hospital's not ready.
Because of the potential for international travel, whether there's, disease in Africa or the Far East, we have to be prepared to deal with patients who come to our emergency room with any infection.
The first step, asking the patient if and where they've traveled.
The travel then alerts you to the next series of questions.
He says if the patient was experiencing Ebola symptoms like fever, abdominal pain, and bleeding, they'd be moved into an isolation room.
We have several rooms that have that negative air pressure with an anteroom, the ability to do contact and respiratory precautions.
But he says there's no risk here of contracting the disease.
So in this country, there is no Ebola other than the 2 cases that were brought in to Emory in Atlanta for management. There's no other Ebola, so there's no risk of catching it. And I think there will be much more interest now in developing pharmaceuticals that will assist in recovery from this.
Dr. Parry says the city's been briefed on what to do if there ever was a patient with Ebola here, so now Stamford EMS, Fire, Health, and Public Safety departments are prepared. I'm Christina Chiarelli for It's Relevant News.